On Zoom again? Great. So welcome to everyone out there in the Zoom audience. I know there are many people out there in the Zoom audience as well as people here. And this session is being conducted by Shannon Valesi. And it's about wicked problems and messy data. And there's nothing more messy than homelessness data, but there's nothing better, if you like. And Shannon's had a really significant history undertaking work around, for example, the original 50 Lives evaluation, doing a lot of other work in homelessness research, a lot of work connected to healthcare and homelessness as well. And the real beauty of Shannon's work is that it's engaged research. So it's not only robust and really strong research, but it's highly engaged. And in that sense, she understands why we've got this messy data, because only when you're out there and engaged that you can really get inside this. So this is really important, bringing the actual life, if you like, of that data together with analysis. It's really very important. So I'd like to welcome Shannon, and thanks so much.
No worries. All right, well, we've got a much shrunken room compared to the previous sessions, but that's okay because, you know, we are talking about data today and it's not for everyone. But good news for you all, I actually am not presenting any statistics today. It's actually more of a conversational piece around some of the challenges over the evaluation work I've been involved with over time more than anything. And if it's not going to make it too hard, I'm happy to be interrupted with questions, especially given that we're behind time. So if you do have a question while I'm going through things, just put your hand up and someone will find a microphone for you. Same for Zoom. All right, so a little bit about me before we get started. Over the past 6 or so years, I've been quite heavily involved in a number of program evaluations in the homelessness space, including what I spoke about earlier in the panel around the 50 Lives 50 Homes and 20 Lives 20 Homes project, but also a number of healthcare initiatives. So been doing a lot of evaluation work with Homeless Healthcare and the Royal Perth Homeless Team, including their sister project at Bentley Mental Health Service. So they've got a mental health homeless pathways and a few other programs there as well with St. Pat's and the sector more broadly through the by name list. So some of the challenges and solutions that I'm talking to are kind of a mishmash of things I've worked over the years. So this is probably my only sort of definition slide before we get going. And I just really want to, more than anything, emphasise the importance of having different types of data and accessing the data where you can. So while we may have a lot of quantitative stats that you have to collect for program funding and things like that, we shouldn't underestimate the power of qualitative data, so stories and feedback and how people are actually going in the services. Is what you're providing to them what they need and things like that. So I think sometimes we get a little bit caught up in providing exact numbers around things, but actually the experience of people that you're supporting is just as important, if not more important. And same here. So we've got two different kind of levels of data that I might flick between through today. So we've got individual level data. So Mr. Smith, he's 50 years old, he's been homeless for a long time, he needs a ground floor apartment, he has a bunch of different health conditions. But we've also got the more service program organisation level data. It might be 100 odd people experiencing homelessness and all of them need ground floor apartments due to whatever reason. So there's different ways we can kind of cut the data to tell the story we need to. So I'll probably fly through this a little bit. There's a range of reasons why we actually need to collect data beyond just providing metrics for your funders and getting the next lot of funding report in, but actually, you know, with what we collect, we can actually start to tell a bit of a picture about who the people are we're supporting, what sort of their needs are, what are sort of the gaps in our services or the sector more broadly, and can we actually start to make change in terms of the programs we're delivering to have better outcomes for everyone. Now, I don't say all this without acknowledging that there are a lot of challenges. You know, resources are stretched. People on the ground have limited time to collect and input data. They're busy providing those services. Generally, people are asked to report more on outputs rather than actual outcomes. So, you know, you made 100 contacts with a person or got 100 people housed, but actually how many people of those sustained housing? How many people were housed in the area that they need? How many people feel safe in that housing? And actually exploring that a little bit more deeply. And I've got a quote here. I don't know if it's big enough for you to read, from Amanda Stafford, who I work quite closely with at the homeless team, around sometimes that, you know, us in the community sectors all want to do the right thing, but unfortunately that's not always what appeals to Treasury or whoever's putting out budgets. They want to see demonstrable numbers. So it's kind of getting that balance impact right between different types of data. I might just skip over this just for timing's sake, but there is a number of reasons why people, essentially data collection is poor. And as I said, people are stretched on the ground in terms of what they can do in a day and not necessarily thinking through longer term impacts of not collecting data. So you might have like a pilot project, for example, and you're ready to get on the ground and get things set up and everything like that. But actually you get towards the end of it and realise you haven't collected any sort of evidence to say why the pilot should keep going if it's been successful. You might not have captured how many people were turned away from that service, how many people were supported into long-term accommodation, for example. So that's kind of what I'm going to have a bit of a chat about now. And as I said, raise any questions you want. Maybe have a think about, are these challenges something you've also experienced within your service? And maybe how you could think about collecting data differently for the future. So as researchers, we're often called in halfway through program delivery with someone saying, we want our service evaluated. It happens quite a lot. And, you know, this does have challenges, but it doesn't mean it's impossible to do. So this is kind of where those afterthoughts come through where, oh, it'd be really good to have a report or an infographic or some sort of evidence behind us around how this program is going. So what we tend to do a lot is really flexible study designs, incorporating that qualitative data, capturing case studies of individual level stories, making use of what available data might just be captured within usual service metrics. If there's the possibility of it and, you know, all the consent and there's a bit of funding involved and everything else, you can access other data sets. So a lot of work around the Housing First stuff, we've been linking to administrative, health and police data. And that can be quite a lengthy process to get that data, but actually it shows if we have the date someone signed up to a program or the date they were housed, we can then look at their history and start to get a bit of a picture of their journey going into that, and we don't necessarily need other baseline data. So a specific example of this is when we're called in to evaluate the 50 Lives program. So it was about a year after the program had started, we were engaged to do the evaluation. So we didn't have any influence in terms of their day-to-day Excel data collection framework, but it had really rich data in there. They were already collecting data on one, when people actually signed up to the program, when they were housed, when they lost their housing, the reason why they lost their housing. So we could then link it to other sources such as the administrative data and start to get a fuller picture of what was happening. They were also doing the VI SPEDAT survey, which has been spoken a bit about today with everyone. So this collects a whole range of risk factors for vulnerability and health conditions and things like that. So again, tapping into where other data sources may be available. This is another very common issue for us. There's some really rich data in people's systems, but it's really messy. It's really not designed for program evaluation because you're providing a service, you're providing that client management system type data. So of course, it's not necessarily designed for evaluation. And it can also mean that multiple different people are entering into the same data set. People have different interpretations of variables. Different things are spelt different ways. Dates are even put in different ways. And that can be really hard to then actually extract data out. So again, some of those, as researchers, we tend to be quite hands-on with the services we're working with and usually feedback to the staff on the ground who's inputting it. Like, actually, if you just don't use any capitalisation, it'll be standardised. Or maybe we create some drop-down menus for you so that there's certain options to pull things out and less free text and things like that. So there is different ways to overcome these kind of messy client management systems. So one example was where we're working with Homeless Healthcare. They've got 11 different services or clinics that they run. Each clinic was collecting their own separate Excel sheets. Each of those was being entered by multiple different people. So when we actually try to pull all the data together to say, oh yeah, Shannon's had contact with 10 of the 11 services and she's been seen however many times and these are her health conditions, that sort of data. What we actually found was the same people were entered in the system multiple different ways. So there was actually one person in there that had 14 different spellings of their name. And that was, Pam's just what I've made up for this example, but there was shortened names with capitalizations, without capitalizations, with extra letters on their surname, but it was actually all referring to the same person. And if you just took on the data on face value, it may have seemed like you were supporting a lot more people than you actually were. It actually involved a lot of kind of data collection and cleaning. And yeah, part of what we've done is, fed that back to the clinics. And now there's things that automatically extract from their client management systems so that things like that are automatically populated. So you're not relying on people manually entering different spellings or names or different formats of dates of birth and things like that. So as I said, data sets or client management systems are not set up for research, and nor should they be. They're there to serve a purpose, to show the support you're providing to clients or to the people you support. But actually, what happens is that we get brought on for an evaluation and we might be told there's amazing rich data in the system, but actually there might be no export function. So there's been amazing examples where people have, community services have contracted IT companies to develop their own really amazing interactive data client management systems, but then they don't have an export feature, or all the rich data has been attached in a PDF, a scanned PDF, so we can't get anything out of it. So I suppose from an evaluation point of view, it's actually having those discussions with people up front or before they even get systems designed about if you're thinking that you want research and evaluation in the future, what steps can you take now and what things should you include in there to make it an easier process down the line. And as I said, so one of the programs, again, we were evaluating that, yeah, they developed a whole amazing client information system, but all the main data was on scanned PDFs. And again, it involved a lot of manual work and entering to overcome that. The other thing as well is, 50 lives, 50 homes, we're evaluating that over 5-6 years. In that time, the data management systems changed 4 times. Luckily for me, I was quite heavily involved in that process throughout. And as things were transferred over, we could make sure that the right data metrics were captured along the way so that we could still, follow the key things for the evaluation. Things, of course, were lost, but there are little steps you can take to make the process smoother. We also often get pulled into evaluations where people haven't actually even thought of objectives. So some of our first steps are often sitting with the organisation and actually working out what they want to measure, what the service is going to achieve. But sometimes you might have really unrealistic expectations around what the service can do. So you might want to end all of homelessness, but actually you've got a team of 2 people and actually your remit's to provide an after hours care or a drop-in centre or something. So you only play a small picture within this whole system. Or we often get as well, we want to show that it's saved the health department money, or we want to show that showed the justice system money, but actually there's no intervention in the first place that would lead to these outcomes. So it's again getting people to think about what are the touch points within the service, where can we actually make a difference, and where can we make these objectives more realistic. And I suppose part of like what we can do there is actually start those conversations and start to revise some of that communication to get on the same page and work out what's realistic. This is very small text, but essentially this was actually an objective we wrote. It was for part of a health department thing, but actually reflecting now back on it 2 years later, we were never going to reduce the hospitalisation for this particular group by 50%. So this program was providing outreach mental health support for people. Part of what they were doing was really engaging with people that were quite actively in psychosis, really mentally unwell, still rough sleeping. And one of the key outcomes for that program was actually getting people into mental health wards and having that kind of respite type care and working things out and getting onto the medications and everything. So when we haven't even evaluated this program yet, but I can guarantee we're not going to meet the reduction in 50% of hospital use. I actually think it's probably going to go up because that was part of the intervention. And we didn't quite think through some of these things, again, when we're implementing them at the beginning. But where you can start to show the picture is through those kind of case studies and other storytelling methods. So again, it kind of comes back to some of the service delivery stuff. Collecting data for kind of data's sake can be really time consuming on staff, especially when, you know, you've got limited resources, limited time to be out in the field. And when you're reporting into multiple different systems already, so people have to report into their own client management systems. They have to report into, the SHS SHIP databases. They have to now report into the by name list and other sector-wide programs. So it can be really difficult where organisations then have to collect like a whole separate evaluation outcome on framework. So again, thinking about what data has already been collected in other systems and repurposing it for other, lack of a better word, for evaluation outcomes. Reporting findings back as you go back to staff to encourage them to see why it's important that you're collecting it along. There's nothing kind of, I suppose, more frustrating in an evaluation world where, we might be evaluating a program for a really long time, but no one wants to hear it, the results 2 years down the track. They want to know how they're going along the way and how we can change programs and service delivery and outcomes during the journey. So part of that is making sure you're feeding back to the staff and people on the ground and letting them know the impact that they're making as they go. So again, I go back to Helmers Healthcare a lot because we've been able to kind of have a lot of input on the ground in terms of their data collection frameworks. But now they've gone from having multiple spreadsheets for every different service to actually a more automated system. So it's about streamlining some of the data there. It's also about having a think about, is the data of the story you want to tell actually being collected? So part of their, street outreach and engagement program, their data that's generally collected is the type of support they provided on that day. So it might be just down that I provided Shannon with wound care, but actually it's a lot of relationship building and trust building, and it's actually taken 100 attempts over every day of the week to actually even get me to talk to that person, for example, and none of that is necessarily captured within the data. So it's having a bit of a think about, do the outputs actually speak to everything that's being done in a service? Has thought been given to what else is happening? And can you increase it? And then Uniting have also, created an app. So rather than waiting to go back to their office and report some of their findings afterwards, they've actually got this ability to create hotspots and target their outreach on the ground and make a more purposeful impact. So again, having a bit of a think about, and this kind of comes back a little bit more to outputs versus outcomes. So having a think about why you even collect data or metrics to begin with. So we were working with a service that was counting the number of toothbrushes or pairs of thongs or whatever it was they were handing out, but actually it had no remit to what they were funded to do. The goods were donated to the service. It was creating extra tasks and time for the staff to record how much they were handing out, and it didn't actually tell you however many people were being helped. So it's starting to have a bit of a think about, does this data even need to be collected? Is there other things that we could collect to have a better impact? And also starting to have a bit of a think about what frustrates you about your role. Is there some sort of gaps that you're constantly coming up against? Is there data you can collect on it to start to provide evidence around, we don't have enough one-bedroom apartments? Okay, we'll start to think about how many people that you support are waiting for that type of property. Instead of just that there's 100 people waiting, okay, 95 of those are waiting specifically for one-bedroom apartments, and start to target that advocacy towards the services that can make a difference. And I think quite importantly, it's knowing who your audience is as well. So when you're reporting back to people, whether that's staff or your board or to the public, whether that's through different means, have a bit of a think about what level of data you need to go into. Do you need to provide that really high level statistical analysis, or can you just provide like nice snapshots, graphs, infographics, something that catches people's eyes and not get too bogged down in the detail there? For example, over the last couple of weeks, I'm sure you've all heard now, it's been quite a few different media stories, but last year we were counting the number of deaths in Perth. Now, it's not a perfect metric. It's only for the 3 or 4 services we were working with, health-based services. But it started to capture a bit of a message that, last year we had more than 1 death every single week of people dying while they're experiencing homelessness. So, again, not perfect, but starting to target out one key fact to the media, not getting bogged down in every other detail about those situations, and just trying to make change and increase people's knowledge around the topic. So there's been a bit of talk about the by name list today. So essentially what we're doing is there's a lot of organisations involved across the homelessness sector in Perth and Fremantle, and some of the other regions are coming on board slowly. But essentially it's a live database capturing who is experiencing homelessness in the community. And we know people by name. And what we've been able to do is actually start to capture data from across services. So we can say that, Joe Bloggs is now connected with Rua and St. Pat's, and he's also got support from Passages. And actually, maybe you didn't know that before, of all those touch points. And we can start to produce some measures like this that have the summaries around how many people are exiting homelessness, how many people are entering. Is there a disconnect between that? Are more people entering homelessness every month than they are exiting? And what does that tell us? And what changes can we make? Is it strictly a housing outflow issue? Or Are a lot of people going into prison? And if so, why? Are a lot of people being taken off the list because they're becoming inactive and we can't find them? That might suggest that there's issues with the outreach measures we have, or a lot of people leaving Perth and going to other areas. So you can start to unpick what some of the data is telling us. So at the moment in Perth, there's about 500 people rough sleeping on any given night. We know that by name, so we know who these people are. This can be quite a big, overwhelming start to make. You know, that's a lot of people to try and house in the current climate. But actually what we've started to do through some of our improvement teams is dig down a little bit. So as a group, we decided that the first group we're going to target is people over 55 years of age that are currently rough sleeping, that have full consent to be on the by name list. So this brought it down to just 21 people, much more manageable number to start making a difference with. Of these 21, 10 didn't have a lead worker. So part of the first job that was involved was actually, all right, what sort of services can these people be involved with? Do any of the services have current capacity to case manage these people? For the 11 people that were already connected with the support, are they on the priority housing list? Would they consider specific over 55s housing? And then from there actually start to match people with available housing options. And at the moment, you know, we started this goal 3 or 4 weeks ago, and 5 of those people with another one have already been housed. So I think the other person will be housed this week or early next week. So, you know, in just a couple of weeks, we've been able to really target down and find alternatives, housing solutions for a group that there might be different housing options for. And then I think the next group we might look at is veterans, for example. Again, it's a small group, but there might be different housing available through DVA and things like that. And it's starting to pick out tiny little groups, and slowly over time, what we'll do is actually make an overall dent, hopefully, to that 500. So just to kind of more, not to sell myself short of my role, but you don't have to always have a full formal evaluation. Evaluations can be costly, especially if they're done right. But have a think of, as you're setting up your programs or services or whatever it is, what's your end goal? Do you want to be able to publish the data? Do you want it to be considered best practice? Do you want people nationally or internationally to know about the work you're doing? For things like publishing, you need ethics requirements, and generally you need an academic affiliation or university on there for published work. Academic writing is a very different style to report or internal publication. So having a bit of a think about, where do you want your program to go? Because not everyone will need that more rigorous academic work attached to it. Don't underestimate the value of independence. There's nothing quite like you saying that your program's amazing and that you helped everyone, but actually having someone external to your organisation come in and say, yes, we've got some data on it. This is the feedback from the stakeholders and our consumers. You know, it's had great successes in XYZ, whatever the program outcome is. That independence can really speak words in terms of securing additional funding. It also allows for confidentiality if you're asking feedback from staff, for example. So if there is internal issues, people aren't necessarily as, afraid's not the right word, but people are more able to speak their mind if it's someone external coming in and it's confidential and their name's never going to get back to someone that there is challenges within how services are delivered. Also a bit of academic freedom. We're not limited to, you know, speaking to the media and calling things out. We don't have to go through a formal process like some people might have to within the organisations, like some of our colleagues within the health department. It's got to go through about 100 different levels of approval before they're allowed to speak publicly. Having that external evaluation, we can kind of waylay some of that and actually start to speak about what's working really well and what some of the challenges are. So just having a bit of a think about that going into new service implementation, about what you want your end goal to be. So these are my last little nuggets of advice around data. So qualitative data is still data. Don't forget that. The power of narrative and stories can be really what moves people. It's really what sticks in those media stories and things like that. Yes, the quant numbers and everything else is important to certain people within organisations or funding bodies, etc. But don't underestimate that, because people will remember that tragic story that you told them, or how someone's overcome some sort of challenge and persevered through that, and now they're doing well and whatever else. Don't get too bogged down on perfect data. Data, remember, is only as good enough, can be good enough. So, for example, some of this stuff around the deaths. Yes, we know that it was probably a lot more than 56 deaths last year, but they're the ones we could confirm, and we can start to build that evidence. And now we've got that, we can hopefully now apply for, further funding or grants or whatever to get bigger access to more administrative data, more solid data, to kind of further that argument. Know your audience. Don't go into really hard statistical analysis and crazy modelling graphs if actually what people want to know at the end of it is you made a 70% reduction in this, or you saved a $10,000 or whatever it is. Think about who the audience is and what's going to be best waylaid by that. Not forgetting that data is power. So funders do want evidence of outcomes. They want to know the actual difference you're making before continuing that funding. And, you don't want to get to the end of a program like so many people have and think, oh God, we haven't actually collected anything. How are we going to justify it? Collect stuff along the way and collect anecdotes. Have a think about, who some of your key champions are and supporters in the organisation that you can come back to and speak to, and, collect some of that more qualitative data. Also remember, you're not alone. Every organisation has challenges. No one's data is absolutely perfect. The data is only as good as the people entering it, how the people entering it have interpreted it. Everyone interprets it differently, and especially when you've got sometimes dozens, hundreds of people entering into the same sort of management systems, there are going to be issues there. And probably what I haven't put up there is be a little bit skeptical. If something comes out and it really doesn't seem right, go back and have a manual look through it. The amount of times where we've run something and it might say 0% have heart disease or something like that, and you think there's no way that a group that are really chronic rough sleepers are going to have no heart disease or something. There may be something wrong with how the data's exporting, something wrong with the analysis along the way. So actually have a bit of a think around why some of the results might be so different to what you're thinking. And the last thing I will say for today is the Council to Homeless Persons do an issue of parity every month. And this is a magazine specifically on homelessness. Anyone can contribute to it. Their December issue is specifically on Western Australia. So if anyone has a bit of an idea around or wants to publish a little bit of a story around a program they're working with or a new service or anything, you can contact their publisher, Noel, directly. All the details are on the Council to Homeless Persons website, but it's a very easy kind of conversational piece to put together for people. So I encourage people, if they've got a program that they want people to know about, to submit something to the article. Yeah, that's me.
Thanks, Shannon. We have some questions from Zoom. A question from Zoom. Interested to know what could be done at a sector level in terms of capacity building to aid your work. Rather than working organisation by organisation, what can we do to raise confidence and capacity? Do we need to have some sector evaluation sessions where you and others provide a framework for good practice that would help services and you?
Yeah, so this is some of the work Paul does more broadly than me. He's got all the outcomes measurement framework and does courses however many times a year. 8 or 9 times a year, and they're quite in-depth courses over a couple of days in terms of learning different outcomes, frameworks and measurements, and can be some of that collaborative work there. I mean, in terms of some of the collaborative data, I think where we're going with things like the by name list, where all the organisations are buying into that, and you're starting to get a standardised data collection tool across the sector, you're starting to get a bit more of a fuller picture in terms of who's being connected with what service, and a few similar, I suppose, variables across that, so you can start to compare how people are connected and what needs they have. And I forgot the first part of the question. Yeah. Yeah.
So what could be done at a sector level in terms of capacity development?
Yeah, look, it might be something worthwhile to have a bit of a chat with John, who's had to run off, around some of those pulse sessions, if that's something that people want to be involved with. The pulse run once a month, you know, so we could have a targeted morning on that kind of collaborative sector capacity type building there. Yeah, that's probably my only solution that comes top of mind right now. Anything else? Well, thank you all for actually staying, and, you know, a lot of you have been here all morning, so we've gone into 4 hours of talks and listening, so well done for making it through. Hopefully it wasn't too dry to end the day on. And as I said, you know, you're starting to have a little bit of a think about reframing some of the work you're already doing and how you can start to make that an argument and evidence and support for, getting it out there of all the amazing stuff that you all do. Thank you.